This is CBS 5 News, telling it like it is.
It's 5:52. You're supposed to floss and brush your teeth twice a day. Do you do that? Do your kids? Setting a good example, overcoming the fear of the dentist, and other things you need to keep in mind for healthier smiles for your little ones after this quick break. 5:54, welcome back. February is National Children's Dental Health Month, and we're live with Dr. Eric Ellis, who has two practices here in the Valley, one in Levine, one in North Phoenix. Right. And you're talking about helping walk us parents through some practices that we can be doing at home to make it a little bit easier on our kids who might have a fear of the dentist's office already. Does that come from us as parents?
A lot of times it does. Okay. That initial visit is important and crucial because it's the only experience that they have.
Right.
So if we have a good positive initial visit, typically age 1 and subsequential every 6 months, we can have a positive view of the dentist, possibly stay cavity free, which is our goal. Yeah. And we won't grow up with the fears that maybe you and I had as a child.
Okay, and I think the problem a lot of families have is what happens in between those 6 months, making sure, because some families say, okay, it's time to brush the teeth, but parents, how much should we be doing of the teeth brushing instead of letting our kids do that? They always say, I want to put on my clothes, I want to do this and that. We need to be stepping in and doing the brushing for them.
That's absolutely true. Kids typically don't have the dexterity to get the front and back sides of their back molars. Okay. As my twins do, my 4-year-old twins, we stand in the mirror and they brush the front sides of their teeth, and that's typically all they know they have. But as parents, it's our job to get in there and get the nooks and crannies. It's our responsibility, hopefully, to brush 2 times a day, 1 after breakfast, 1 before we go to bed. And we'd love to introduce flossing 2 to 3 times per week would be great, ages 2 to 3 years old to start. Any spaces that we can't see between, it's a good idea to floss between.
And I've seen those like handheld little picks that have the floss already pre-flossed. Do you advise those for kids, or?
Whatever's easier. Typically the kids won't have the ability to get to all the spaces, but it's a lot easier as parents for us to have the dinosaur-shaped ones or something fun to use to get between the teeth.
I know, and I asked him what other kind of tricks he has in his office because, you know, do you have the DVD playing up above, stickers and rings and fun things to give away for kids? But you also have other tools that you're using in your office that, as parents, sometimes we think about if you have to get a shot, you have that anxiety over the pain, and like 15% of patients avoid the dentist's office because they fear the pain.
So that's the biggest hurdle. A lot of times with pediatric dentistry, a lot of the shallow fillings that we have with children, we can utilize sedation medicine to get the child comfortable. We use a lot of behavior management techniques. But we also have a new product. It's called the DentalVibe. Okay. I've been using this with good success, and basically we use this like we would use the mouth mirror during a traditional dental injection, but it vibrates and pulsates.
And it kind of is a distractor, so once that's in there and it's vibrating, it's just distracting from the pain you might feel.
It's a lot like an electric toothbrush.
Wow.
But that stimulus actually blocks the pain receptors, so traditionally kids don't feel the injection, or adults.
Pretty cool.
Yes.
Sign us up. Thank you very much for talking with us.
Well, thank you.
As we take a look at our dental health for kids. This is the month we should be focusing on it and just remembering it year round. Thank you so much.
Thank you.
Dr. Ellis. Okay, 2 practices here in the Valley. Pat?